Inside Connecticut Children's Hospital in Hartford, doctors and nurses are sounding the alarm. They're seeing an unprecedented number of children with respiratory illnesses.
I have not seen this level of very quick increase in the number of cases with RSV, and certainly we have never seen it in this time period.
The hospital's in touch with FEMA and the National Guard about putting up a medical tent in its parking lot as it tries to keep up. Respiratory syncytial virus, or RSV, usually causes mild cold-like symptoms. There's no vaccine for it. Infants and older adults may develop severe infections from RSV, like pneumonia, because their lungs are weakened. Over the last month, 32 states have reported an increase in RSV cases. In San Diego, 50 patients have tested positive for RSV over the last few days at Rady Children's Hospital, where the chief medical officer says it's unheard of, 2 to 3 times what they've ever experienced. In Richmond, Virginia, Haley Mitchell's 13-month-old son was hospitalized.
That was mine and his first time being in a helicopter, and of course it was very scary. The EMTs in the back told me that there was a couple times they had to give him oxygen while we were flying.
Back in Connecticut, at Yale New Haven Children's Hospital.
Have you ever seen numbers like this before?
We have not seen numbers to this degree this early.
RSV cases in the emergency department have nearly doubled over the past week.
Right now, every bed in this pediatric ICU is full, 90% of them with respiratory illnesses.
Most kids get an RSV infection by age 2, but it can happen at any age. Health officials say the spread of respiratory viruses like RSV can be prevented through hand washing, staying home when sick, and wearing a mask if you have any symptoms. Typically, RSV peaks in February, but this season, all bets are off.
It's so unpredictable at this point. We're not really sure when it's going to peak and when it may come to an end.
Okay, this is obviously scary for families with small children. What's the thinking among doctors as to why they're seeing this early surge?
Lester, a lot of this may be due to the fact that young children had relatively little exposure to other kinds of viruses during the last several years of COVID, and now this is hitting their immune systems all at once.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.